I would pray that if it was in the Lord's will to call them home, that he would not call them home while I was sitting there. Really had to hold her leg up, like as she's pushing the baby out. So I'm like right here. Hi, hey. I feel like I'm so awkward when I like am doing a sit down video. I don't know what it is. I'm like, how do I say hey? What am I doing? Anyways, hello, welcome back to another video. So before getting into the video, since we are discussing patient care hours, I wanted to share a resource with you that I think would be very helpful. And it's my PA Box. It is a tool that allows you to search for program requirements to see if you're eligible and also stay organized while applying to PA school. Unfortunately, I was not familiar with this while I was applying to PA school, but I wish that I was. So let me show you how this can be helpful for learning about which schools that you can apply to based on your patient care hours or how many you plan to gain. And obviously this can be used for a lot of different things, but since we're talking about patient care, that's what I'm going over right now. So as an example, I am putting in North Carolina since that's where I live, but you can put in wherever you want to go to PA school. Typing in 500 healthcare hours to see how many schools I will be eligible for if I only have 500 patient care hours. And as you can see, there are 7 schools that have that requirement, and you can see them listed here: ECU, Elon, High Point University, Methodist, Pfeiffer, Wingate University. And then I'm going to go back and search again. So let's say I'm going to have 1,000 patient care hours. There's 13 schools that I will be eligible for. So they gave me a little bit more, and you can see them all listed here. So like I said, I think this could be very helpful, and you can use my code BINDUR for 15% off, and I'll include it down in the description box. So in today's video, I wanted just to go into more detail about patient care hours because I'm still getting questions about them. So let's just get to the point. I'm going to talk about what I did for my patient care. But before I do that, let me just put this list here of what CASPA and I guess most PA programs consider to be patient care. This list is not exhaustive, so please don't feel like if it's not on here that it's not considered patient care. That is not the case at all whatsoever. There are so many job titles that I did not list on here. I kind of just went off what was on top of my head and from people that I know that did this, that are currently in PA school, have completed PA school, or are about to start PA school. So that's what I have here. A lot of people still ask questions. People always ask me, what can they do? I'm still getting messages, which I'm grateful for your questions. To me, I think that it is easier to get patient care hours if you have some sort of certification. Certified nursing assistant, emergency medical technician, medical assistant. It is a lot easier. However, I am all about faith and doing things outside of the box. And I don't think it's necessarily outside of the box. There are a lot of people that have patient care hours that never got any type of certification, especially these days. Like, I think there's places where you can work as a medical assistant, and I guess it's not a certified medical assistant, but you're still like having patient care hours. And there's different things that I talked about too, like home health care, like being a home health aide. Some of those jobs don't require you to be a CNA. The ones that I'm going to talk about for my patient care hours did require me to be a certified nursing assistant, but I do know that there's some these days that do not. And I know that because I was recently, in the beginning of the summer, was looking for like part-time jobs just to make a little bit more money before starting school. But my nursing assistant certification expired, I think, back in 2020. And there were some jobs that did not require me to have a CNA certification. I just didn't do them for various reasons. My schedule, a lot of things. I'm not trying to work like a slave before school starts. Somehow the Lord is going to provide financially. I don't know how, but it's going to work out somehow. But I couldn't do it to myself. I've been working for too long. Anyways, that's besides the point. Sorry, it's not about me. We're not talking about me right now. So let's get into what I did and what I feel like how I feel like it was helpful. Maybe it'll help you decide if it's something that you want to do. So let's just start way back. And I'm also going to show you what I wrote on my CASPA application for these jobs. So my first one for patient care experience was being a nursing assistant and home health aide. And as you can see here, I have the dates of my experience. I put that it was part-time, but I was working about 15 hours a week. I put the total weeks, which gave me the total hours, which was about 870. I'm not going to read off of this for everything because you guys can read and see it. But so for experience details, I said my responsibilities working with the geriatric population included assisting with ADLs, including cooking and feeding, transferring, walking, cleaning, bathing, driving clients to daily appointments, and reporting any concerns to the nurse. So I said this with the geriatric population because with this job, that's mainly what I worked with. But what I just explained here is literally what I would do on a day-to-day basis. Sometimes it was just the patient just needed or client just wanted companionship. Sometimes some of them could move around on their own. There were some that weren't able to move around as well, and you had to help them do different things, whether it be getting in the shower, things like that. And like I said, reporting any concerns to the nurse, because if something was wrong, blood pressures were off, anything like that, I would have to call whoever there. I don't know if they call it charge nurses in home health. I don't really remember, but that's what I would have to tell them. So that was my first job. The next one was also a home health aide and and nursing assistant. And you can see the time frames that I work here. You can see the number of hours. And then I put, as a CNA/home health aide, my responsibilities included providing care to a young girl with cerebral palsy and Turner syndrome. I prepared meals, fed, bathed, stretched limbs, and assisted with ambulation using various ambulatory devices. I also participated in clients' occupational, physical, and speech therapy sessions. I said the nature of this job helped develop my intuition as I had to find alternative ways to determine the need of a patient who was unable to express it through written or verbal communication. So for this one, I wrote what I feel like I learned from this position, because I feel like this also, putting this and giving specific examples, makes them want to be like, oh, okay, I want to learn more about this. So yeah, this is pretty much what I did with this job. And I missed her and her family, but this is pretty much what I did. I put it all here. It was definitely a lot different than the other home health aide position. With the other home health aide position, I would have different clients all the time. And for this one, I stuck with this one girl. I feel like that really did help me because she couldn't talk. Sometimes there were ways that the speech therapist would come up with she had this certain book, and it would have different pictures and things on it. So trying to get her to point to those things if she wanted something. Or giving her different signals for saying yes and no and things like that. But I think sometimes even those signals wouldn't work, and I would just have to learn to get to know her and figure out okay, this is what she's crying about. Oh, she's mad because she loved music, she wants to hear some music. Oh, she doesn't like that. And just different things. So that was what I did for the most part in that job. And of course having to that, because like I said, she couldn't walk either, and so had to help her with ambulation and just different devices and things that she had around the house. So that's what I did for that job. And it was just, let me just say, so for when I started working with the company in which I ended up with this young girl, it was going to be the same thing as my previous job that I just spoke about. So it was going to be, whenever there was a case, going to that case, or maybe having a specific case, but it could be someone that was older. But I happened to come across this one girl, and then her family just loved me, and so that was my only case. So the point I was trying to make here is that this was through a agency. So it wasn't like I found them on care.com or something and was working with her. I just wanted to clarify that, because I do think that there are schools, and maybe all of them, that will not consider home health aid as patient care hours if you are not reporting to someone. So in an agency, there's usually a nurse that's over the case, and so that counts. But I think if I would have gone through just her family directly, that probably would not have counted as patient care hours. So I wanted just to be clear on that. Okay, next is my nursing assistant / health unit coordinator position, and everything is here as you can see. And my experience details, I said my duties included completing vital signs, assisting patients with ADLs, and completing safety checks in 15-minute intervals to ensure patient safety. I also planned and facilitated community group meetings to help patients reach their goals and reported concerns to nurses, providers, therapists, social workers, and physicians. Lastly, I checked patients into the unit and ensured that legal paperwork was accurate and remained up to date. I learned the importance of building rapport to make the patient comfortable, leading them to follow treatment plans to achieve optimal health. I definitely had a couple typos in here, like where periods and commas could have been, but just go with me on it. Definitely double check that, guys. Don't do what I did. Double check it. So yeah, I talked about like what I learned here, and I think the biggest thing with me saying what I learned was the importance of like building that relationship with patients, because some of them wouldn't want to talk to certain people. There were times where, and I don't say this like to boast or anything, but there was times where the doctor would come and talk to me and say, can you get this patient to take their medicine? Obviously I couldn't give them their medication, but it was because I had built that like rapport with them. And so when they wouldn't listen to the doctor, they would, you know, say, hey, you know, they'll listen to you, you know, whatever. And just to like talk them down and say, hey, listen to and I would just tell them like, hey, listen to the doctor, and just, you know what I mean? So I think that was very important. And so that's why I put that in there too. But yeah, that was the most of what I did at that job. Like I said, vital signs, doing safety checks, because it was an inpatient psych unit. There were patients that some of them were at risk of, you know what, and yeah, I feel like I summarized it here, so no need to go into more detail, right? If you have more questions about it, please write them below. You can message me on Instagram. But honestly, I think for this, it would really be helpful if you guys wrote it below, because then I understand like not wanting to put some questions on YouTube, but like for some things, a lot of people have the same questions that you have. So I think it really is going to be helpful and a blessing to other people if they can see my answer to your question. So please just comment below. Please. Pretty please. Okay. So that was that one. I wanted to pause here just to say that although at the time this job required me to be a certified nursing assistant, I am seeing online jobs with the title of behavioral health tech, and some of them say you don't have to have a certification, and there's some that say that if you don't have a certification, you just have to get it within a certain time frame of working there. So guys, I think this would be helpful for you to look up too, because this could be a great way to get patient care hours as well without having to already have a specific certification, and also seeing if you would like the role before going to obtain that certification. So I just wanted to put that out there. The next one, so this is another nursing assistant health unit coordinator position. And so I said I floated as a sitter and fill-in nursing assistant to various units, including Gen Med, Peds, L&D, which is labor and delivery, cardio, neuro, ortho, oncology, urology, and the ICUs, depending on daily hospital needs. A few of my duties included taking vitals, assisting with ADLs, and effectively communicating with patients, families, and providers. As a sitter, I had the opportunity to sit with patients for many hours, which allowed me to converse with them and truly understand their concerns and fears, contributing to their decision to receive healthcare as well as preventative factors. So I feel like this, I really have to try to summarize. So I'll go into a little bit more detail regarding this role. So I worked in float pool, and the way that my days would work is, I think, so depending on the shift I work, sometimes I would do night shifts and sometimes I would do day shifts. One time I was only working weekends. You could choose between doing like 3/12s or doing like 8-hour shifts. That was a good, I don't know if it's still that way now, but that was the good thing about the flexibility. Like you could be like, okay, I'm going to work 5 days a week, 8-hour shifts, 5 days a week. You could do 7 to 3, 3 to 11, or 11 to 7. Or you could say, okay, I'm going to do 3 12-hour shifts, because that's still considered full-time. So you could do 7A to 7P, or you could do 7P to 7A. And so that was one thing I did like about that position. And we would go in and like make our schedules. So the way that it would work is 1 hour before my shift, I would call this number, and the number would have a list of everyone that's working, and it would name them. And it would say Bindu 700, which would mean that I'm staffing the floor that day, because that's a whole unit, not a patient room. And if I heard like 701, that means, okay, I'm going to be a sitter that day. I'm working with a specific patient. So when I would staff the floor, I would work as a CNA for that day. So whatever the floor required. Usually on every floor, it would be taking vitals, emptying drains, bedpans, helping patients get to the bathroom, emptying catheters, taking blood sugars, bladder scans for some patients, bathing and assisting with baths and actually doing baths, like, giving bed baths and things like that. That was the majority of it. I know when I worked the floor in mother baby, that would consist of the CNA. So I would give the babies their first bath, which is so, oh God, it was just so like, how could you be in a bad mood on that floor? Like, oh my gosh, y'all. But yeah, I'll have to give the baby their first bath, do their hearing test. But yeah, so that was what I did a lot when I staffed the floor. And then when I was a sitter, like I said, call before, go to the room. Cases could be anywhere from an older person who was there because they bed rest, or it's not called bed rest. God, I feel like I'm losing like certain terminology, y'all, because I've been out of the patient care aspect of healthcare for a while. And I'm excited to go back to it. But patients that were not supposed to be walking and things like that, maybe they're elderly or just had surgery, or maybe they're I don't know if you find the right terminology to use. They're not the most like alert or coherent. I would have to sit with them, so if they're trying to get up, I can tell them, hey, get back in the bed, or help them with walking. I would see things where I would sit with a patient who had a lot of seizures, and I was just there for if they had a seizure, I would have to like call the nurse to come in, or hit a button for the doctors to come. I don't think anyone ever had a seizure while I was in there though. And I used to pray that they didn't. There's times where I sat with someone that was supposed to be getting moved to like hospice, and it was pretty much like the end of their life, and I'm not exactly sure what the reason was that they had a sitter, and I probably should have asked more questions, but I think it's something that I've talked about. It's like I'm very uncomfortable when it comes to death. Like I can be the most like encouraging person, and that's something that I'm working through, but like I think it's because I can't really encourage you when it comes to death. Like I feel like I have my view from a Christian standpoint of like what death means, and it's hurtful, and it's like it's sad, but it's not necessarily like a bad thing because there is life after. But I can't push those views on different people, so I'm not gonna see someone that like just lost someone in their life and be like, well, they're going to heaven, or like things like that. I just feel like that could be like just a turn off as when it comes to Christianity, and I never want to do that. So I don't think there are words that I can really say that will make a person feel better. And for me, I always want to make you feel better, and so that's why I'm just terrible when it comes to death. And maybe that's why I didn't ask more questions, but we're all learning. But anyway, so in those cases, I don't really know why they had someone there, but maybe it was because they didn't want them to like die alone. But in every case where that happened, I would pray that if it was in the Lord's will to call them home, that he would not call them home while I was sitting there. And God answered every single time, because I can't. I don't know what I would do. I don't. So no. Can't take it. Nope. So yeah, that was some of the things that I saw. There were some patients that were there on psych codes. We all know how there is a shortage of mental health facilities and places for patients to receive care. So a lot of times patients would sit in the emergency room for days until they could find either somewhere within the hospital to move them or to a different facility to move them to. And so because they were on a hold, they had to have someone sitting there with them in case someone tried to like harm themselves, or to get up and leave when they're not supposed to, things like that. And so that was a lot of things where I saw too. It was a lot of, they were both kids and adults. For that, yeah, just being there and like talking and like forming relationships, and that was a lot of what I did there in those cases. And then there were some that were on a medical hold, not necessarily a psych hold, but that maybe they were, if the doctor said if you get up, you're gonna have a aneurysm, or like, I don't know, something like that. I can't think of specific examples at the moment. I can't think of everything at the moment, y'all, but those was a lot of what I saw like as a sitter. Oh, and then there, which I talked about this in a recent video, there was some cases where it was like a suspected child abuse, and so they wanted a sitter to be there for that, whether the parents were there or not. There were some where like, it was like maybe the mom was on drugs or something, and so they didn't want the kid to go home with the mom, or they were figuring out where they were going to place the baby. And this, sometimes it was like a newborn baby. So I've seen things like cases like that. Probably I'm talking a lot because I just had like a lot of experiences, but I think that my favorite case as a sitter, I was going in to be a sitter in labor and delivery, not mother baby, which is separate from labor and delivery. And I remember when I heard that, I was very confused, because I was like, why am I sitting for somebody in labor and delivery? Like, I get mother baby, I was like, because mother baby, sometimes it makes sense, because like I said, sometimes it's a case where the baby isn't supposed to go home with the parent or whatever, but it was for labor and delivery. And so I was like, what? I remember, so I walked in and the nurse stopped me outside the door, and she was like, she's not the most pleasant person. And so she was like, just sit kind of towards the door and just stay out of her eyesight. And I walked in, and I was just like, hey, and then I just sat down. But she wasn't mean to me at that point, didn't really say much. And then I just sat there and was just quiet. And I don't think I processed the fact that she was really like in labor, but duh, I mean, she's in labor and delivery. And so there was like a tech in there that was just checking her. And so I, just out of excitement, I think I jumped up and I was like, wait, you're actually about to have a baby? And I was like, you're like about to give birth? And I was like, I've never seen anyone give birth before. And she was like, well, girl, this is about to be your birth control. So at this point, like, she let me move closer to like where she was, and we were just talking. I forgot how far along she was when my shift first started, but all I know is towards the end of the shift, my shift, she actually went into labor. And so gave birth, and one of the, like, I think, or they call it like stirrups or whatever, were broken. And so I literally had to hold her leg up like as she's pushing the baby out. So I'm like right here, like seeing it. And when I tell y'all, like, it was so emotional, and I was like holding back tears. And I'm getting emotional now thinking about it, but I was like holding back tears because I was like, this is not normal. You cannot cry. You do not know this woman. This is not like your family member giving birth. Like, you cannot cry. Keep it together, Bindu. Hold it together. Stop. Y'all, it was hard, but it was such a beautiful thing to see. And unfortunately, so with that situation, the reason that I was there was because mama was addicted to drugs. And I will tell you what I learned from that situation is that, so the baby came out obviously withdrawing. After the mom gave birth, they took the baby to the neonatal intensive care unit because obviously she came out withdrawing, with experiencing withdrawal symptoms. But so the mom wanted me to just like, push her in a wheelchair to go like out, have a cigarette, whatever she wanted to do. And we were just talking, and she told me about how, like, even when she was in the hospital, like, another reason she had to sit her was because when they would give her epidural, she kept trying to get up, and like she would be like falling and things like that. But she gave me the story about how she became addicted to pain meds. And she talked about how like she hurt herself on the job, and I guess ruptured some disc or something like that with her back. And so then she was taking the medication for pain, but then started to take it just for emotional and psychological reasons, like to try to cope. And obviously it wasn't like the best way, but just like being able to hear her story, and like, to be honest, I never was judging her when I was in there. Like, I understood like what was going on, but I didn't understand why she did it. And I always know that there is a why. And so I just encourage anyone that's like in the field or planning on going into it to just always consider that. And like, because she told me she felt like she was being judged the whole time that she was there. And I don't think it's great to make anyone feel that way at all. But that was probably like my best and most rewarding case while working in flow pool and being a sitter. And then my last set here, I'm going to put these two, you can see them here, but I'm going to, actually I'll read them separately because, so for these two jobs, one of them I was a clinical research specialist senior, and then for the next one I was a clinical research coordinator. They were both in the same departments, in the same jobs. I just got promoted. But to be honest, a lot of things I did when I got promoted, I was doing when I wasn't promoted. So, you know. So for the first one I wrote for a clinical research specialist, you can see my hours and everything here. I said my responsibilities included recruiting, screening, and managing participant visits. Depending on the protocol, study visits can include vital signs, obtaining medical and psychiatric history, administering various assessments and testing, blood draws, drug screens, pregnancy tests, and properly documenting visits using case report forms. For the next one, I said I recruited, screen, obtain informed consent. I should have said obtain, y'all. I got so many typos in here. Obtain informed consent and managed study participant research visits for minimal and above minimal risk studies. Managing study visits included but was not limited to completing vitals, collecting biological specimens, obtaining medical and medication history, and reporting adverse events. I also oversaw all data collection, study visit activities, including the collection, delivery, and storage of biological specimens, conducted quality control monitoring and subject binders, train and supervise junior staff, and develop IRB documents for initial IRB submissions. And I feel like I probably should have wrote out what the IRB is, which is the Institutional Review Board, because some people may not have known what this was when I was talking about it, but hey. So yeah, I pretty much summarized like what it was that I did there. So for the most part for this job, it was both patient care centered and also administrative. So for patients, I would, like I said, do like phone screens, figure out ways to recruit patients. So it would come from me developing like a new flyer and trying to get it approved by the IRB to see if, you know, this would work, and figuring out like getting it approved to see where I could put it, whether it be posting it around like the community, putting it on like a Facebook group, a Reddit thing, different ways of just trying to get that approved. And then from there, people would call me, and then we would, you know, see if they're eligible to come in for a visit. They would come in for the visit. If they were, I would make sure they were consented and take their time to make decisions if they wanted to participate in the study. And then whatever that, I worked on different studies. So whatever that study visit required is what I did. What I just read here was pretty much what that was. And then get into like the administrative part. I had to do like a lot of institutional review board submissions to get things approved. If the protocol changed, I had to make sure I changed that. And then I had to make sure everyone got trained on the new protocol. If there was a new consent form, I had to update that, get it approved, make sure everyone was trained on the new consent form. I would create surveys and put them in our, like we would use RedCap, but there's different things like Qualtrics, whatever else that you may use to complete and administer surveys, things like that. I would get them put in there. I think that was a lot of what I did for the most part. So yeah, you get the both things. And that's why it was patient care, because like I said, we were getting vitals, blood draws, collecting specimens, whether it be like a urine sample that's needed for like a pregnancy test or for a drug test, things like that. Yeah, that's pretty much it. I would say, so you get both parts, right? You get, like I said, you get the patient care, but also you get the administrative, which is sometimes it's not my favorite part, but I will say I think it's a lot of leadership skills that you develop that you can talk about in your application with this job. Because I was pretty much a project manager. Like I was managing everything about whatever projects I was the lead coordinator on. And it comes with critical thinking comes with it too, because like I just said, okay, like you came up with this new thing in the protocol that you guys discussed. Okay, you're like, boom, the protocol has to be updated. Oh shoot, this also affects the consent form. Okay, the consent form needs to be updated too. Oh shoot, this also affects this survey that we did. Okay, the surveys have to be updated too. And so it's like making sure you know what affects what other parts, getting that done, and also making sure everyone is trained on it and is implemented. and all of those things. So I think that it's definitely gives you great critical thinking skills that will be important and necessary as a healthcare provider and as a physician assistant, a physician, anyone. I think it would be really important. And so that's the benefit of that job. There's also, depending on where you work, the opportunity of getting published. That's not required, especially for PA school. However, I did include it in my CASPA application, and so there's a section where it asks for memberships, and it talks about, and also achievement. So for the achievement sections, I did put both of my publications here. So I did have the opportunity to be a co-author on two different research publications. Like I said, this is not necessary, but because it was a section for it, I put them in here. So that's a benefit too if you do consider doing a clinical research job. But please note, not all clinical research is considered patient care, because currently I work in clinical research now. I work at the industry level though. So I'm not doing patient care. I'm doing a lot of administrative things and making sure that everyone and the global team has what they need, and in a sense monitoring what's going on at the sites. I don't really want to say monitoring, but like if we notice like certain things, we tell whoever our local trial manager is so that they can let their CRA know, so that their CRA can tell the site. Sorry if those acronyms don't make sense to you, but it's not even important right now. But so yeah, I still work in clinical research. I no longer am working in patient care. So make sure that if you do find a clinical research job, that it does involve patient care, because not all of them do. And so like I say, a clinical research specialist, a clinical research coordinator, usually it has to be at the site level in order for there to be patient care. But even at that, I think that there may be somewhere you're not doing a lot of patient care. So just check that. But I think that's a good way to still get involved in patient care. It doesn't require any sort of certification. So I would search sort of like those positions and see if you can find them, if that's something that you're interested in. So yeah, I just went over all of my patient care. I didn't include some of the volunteer hours that I did, which was at some clinics, but we can talk about that separately. But yeah, I just went into detail about all of these things. I hope that this helps you. If you have specific questions, if you're trying to figure out what it is that you should do, let me know. No, I don't think that any patient care experience is better than another. I think that when you all come together and the program chooses who they want to be in the cohort for that year, all of those experiences come together. It's those unique experiences come together, and I think it helps people to learn from each other, and that's one thing that I'm excited about. So don't look at other people and say, well, they're doing this, so that's what I need to do. No, I think it's not that deep. It's what I'm saying. Pick a job that you'll get the patient care hours, but pick something that you would, in a sense, consider to be fulfilling and that you're going to enjoy for the time that you have to do it in order to get the amount of patient care hours that you need. It's that simple, y'all. Google a job that you're interested in. If you are a CNA, Google CNA jobs in your area and see if what you would like to do, or look at a hospital website and see what you need. If you're a medical assistant, do the same thing. I just gave you examples of clinical research jobs. Look up clinical research jobs. You can search clinical research specialist, research assistant jobs, things like that, and just make sure that it does include patient care. So yeah, I'm not trying to make this a super long video. As always, I promise y'all, I'm not saying this for no reason. And I'm not trying to make you do anything you don't want to do, but it really will help me if you subscribe and you like this video. Leave a comment too. I'd appreciate that. But I really need you to subscribe and like this video. I love you guys. Thank you for watching. Be blessed, and I'll see you in the next video. Bye.